Charlotte, some good news, but the handling of the Ruby Princess cruise debacle is now under police investigation.
Yeah, it is, Annalise. The New South Wales Police Commissioner Mick has been tasked with investigating exactly how 2,700 people were allowed to disembark the Ruby Princess cruise ship on March 19. It's now led to a total of 7 deaths across the country and 600 coronavirus cases. Now, we know that, of course, this is going to be under investigation by police, but Mick would not outline exactly who was under investigation or what those charges would be. There is some speculation, though, that there were actually documents signed off by the ship's doctor stipulating that no one on board had COVID-19, and that's despite many of the passengers actually presenting with fevers. There has been a bit of standoff between the New South Wales government and 8 cruise ships that have been lingering off the coast of New South Wales, refusing to leave Australian waters. But Mick has said that there has been some progress on that front.
Yesterday when we met, there were 8 cruise ships either docked or off the New South Wales coast. I can say that after a positive day with Border Force and the cruise liners, 2 ships are currently underway and out of New South Wales water. So thank you to Carnival Cruises for that. Sunday we are planning for Royal Caribbean, their 5 ships to be refueled, restocked with healthy crew heading back to their port of origin, which is a wonderful outcome for all involved.
So, Annalise, if you're quickly doing the maths there of trying to figure out what we're left with, it's 1 cruise ship from Sunday, and it is the Ruby Princess cruise. Now, there are some reports that as many as 250 people on board that ship actually are infected. Now, I do stress that it is reported at this stage. That is not confirmed. And the Commissioner was asked that this morning, but he refused to go into detail. Of course, they are all crew members. All passengers have been taken off these ships now. But if we were to allow those 250 people to come to shore in Australia, we do risk inundating our own healthcare system. The ships are well equipped to really contain some of this on their own. They do have their own hospital wards and ICU units, but of course there is potential that some of them may have to be evacuated and brought to land depending on the severity of their cases. Now, in more good news, as well as the cruise ships departing, or many of them, we've actually seen a drop in numbers, Annalise. We've now had 91 cases in the past 24 hours in New South Wales. Now, that is the lowest we have seen it since the 21st of March. The New South Wales Chief Health Officer, Dr. Kerry Chant, has said that this is a great sign to see, and she also wants to see a ramp up of more testing.
We've also been doing a lot of pop-ups and enhanced testing around when we identify a case in the community, and that's really critical for us to map the community transmission in that neighbourhood. But that also goes to why these social distancing measures are really important. So for us to get a really good handle on community transmission, we just need a period of time where the community bears with us.
So yesterday, that number of the 24-hour total was actually 116. So to go down to 91 is a significant drop and something that's great to see in New South Wales. But the main concern, as it has been all week, is the community transmissions. They've still got a number of cases that are coming out each day where they don't know where they were acquired. So that does remain to be the source of a lot of the restrictions in New South Wales. They say if we can keep these numbers low, the government won't have to implement further restrictions. But of course, that requires everyone to do their bit and to self-isolate and also practice social distancing.